Okay, so before entering the room, I would check the provider's orders, making sure what I'm doing is in there. Okay, and then I would not introduce myself. Hi, my name is Alondra, and I'm going to be your nurse today. Can I have your name, age, and date of birth, please? Okay, thank you, Miss Minnie. So I would provide privacy, wash my hands, and put on some gloves. Do you have any allergies, Miss Minnie? No? Okay. From a scale of 0 to 10, 10 being the worst pain, how would you describe your pain? A 0? Okay. Okay, Miss Minnie, so today we're going to be doing a catheter insertion and an NG tube as well. The NG tube is for in case we need feedings or tube suction. Okay. I would sit her up to a 45-degree angle. Okay. And then I would assess for coughing and gag. Okay, looking into the mouth with the tongue depressor, I would assess for gagging. Okay, Miss Minnie, if you want me to stop, just raise your hand or a finger and I will stop, okay? Anything you feel comfortable with, just raise and then I will stop, okay? So I would check the patency of the nares, okay? Choosing which one to do. We're going to do this side. Okay, so I'm going to give her a cup to take a sip of water when I tell her to. So we're going to take this out, the NG tube out, and now we're going to measure. So it'll be from here to here, and then 2. That's it. Which is 53. You'd go a little bit more, go 54 or 55 as well. So we're going to lube. Lube this up. Okay. Now we can start. Are you ready, Miss Minnie? Okay. If you feel any discomfort, just raise your hand or finger. Okay. So we're going to start. Then once it reaches the nasopharynx, she will look down with her chin to her chest. And as we keep pushing, she will take a sip of water if she needs to. I would check for any air. Once it reaches the 25 mark, I would check for air coming out. If there's no air coming out, and I also would check for coiling in the back of the throat, and there is none. So I will keep going with her, taking a sip of water, and I would reassure her that everything is fine, that coughing, that gagging is fine. We're almost there, Miss Minnie. Okay, we're there at the mark. Perfect. So now I would clean up if I need to. Okay. And then I would connect. Pin it to the cheek. Okay. With less tape than that. And then I would get some secretion, gastric juices out, so that we could take the pH of them. I would put it in a little cup, and then I would dip this in there, making sure that it's normal once it comes out, and it is. So then I would put NG strip at the nose, marking where the length I inserted it in. I would arrange for an abdominal x-ray. And then once making sure that it is in the right place, I would pin the tube to the gown right here. And then I would connect to the suctioning at the suction rate that the doctor wants. Okay, Miss Minnie. So now we're going to take it out. So I would take off my gloves. Wash my hands. And then I'm going to put on new gloves. We would also provide oral hygiene before taking off my old gloves to ensure that they don't have any flavor that they wouldn't like in their mouth. Put on these gloves. Now we'll give her a basin in case she feels like throwing up. We also get this to clean around her nose. So with an adhesive wipe remover, I would remove the adhesive going in the direction of hair growth. Okay, as well as with the nose. And the same signals, we would give the same signals as well. Reassuring the patient as we pull the NG tube out, telling them that it's alright. Gag. Okay, I would check the tip for intactness, and it is there. And then I would throw this in the garbage for safe disposal. I would have disconnected it from the suctioning as well. Gotten rid of that, and I would document the amount of suction removed, and then I would provide oral hygiene again. If they need anything else, then they could tell me. Do you need anything else, Ms. Minnie? No? Okay. So I'm going to take off my gloves. I would also check for vital signs before and after. I would have a pulse oximeter in their hand, making sure I can see their oxygen level as I am inserting and taking it out. So right now I'm going to lay you back so that we could put your catheter in. Is that okay, Ms. Minnie? Yes. Raise the bed more. Perfect. So I'm going to get rid of this as well. So, okay, Miss Minnie, are you in any pain right now? No? Okay. Is it okay if I uncover you? Yes? Okay, so before I uncover you, I'm going to check your bladder for any distension. I will palpate it, and I would also have a bladder scan if needed. Okay, so I'm going to uncover you. Is that okay? Yes. There's no redness. Okay, so I'm going to wash my hands again, put on gloves. have her open her legs to a comfortable position for her. I'm going to ask her not to move as it can lead for a higher risk of infection. So I will clean her. I would put on the chuck first, making sure there's no water leakage onto the bed. Okay, so now I would clean her with soap and water. It would be one clean. And the third clean would be inside clean. Okay, and then this would go into the garbage or just proper container. So now you can start with the sterile field. I'll take off my gloves. Okay, took off my gloves. I would wash my hands. Now we can start the sterile procedure. I can either start it on the bed or on the table. So, start it on the bed. So I'm going to move it here, making sure to tell her not to touch anything, not to move. Okay, now I'm going to take the gloves off. Open them. Okay, and then I can this. And like this, tiny side down. There, making sure not to touch anything else. Okay, and then I would put this on her. Now I'm going to prepare everything. Okay, this would go into the trash. Connect the tube in here. The syringe isn't going to stay in there, so when I'm inflating the balloon, I will have to break sterile field in order to put the syringe back in. Okay, so now I'm still sterile. I will open the package, and then I would get one with my hand, clean, get another one, clean, throw that one away, get another one and clean through the middle, throwing them away at the very end. That hand is now not sterile, but this one is. So I'm going to be inserting the catheter with this hand. Okay, Miss Minnie, are you ready? Yes, if you have any pain, just tell me and I will stop. Okay, we're going to insert it until we see a flash of urine. Then we could go a little bit deeper than that. So I can put my hand. So this is where I would break sterile field because my syringe is not staying in there, but otherwise it would be in there and I wouldn't be breaking the sterile field. I would document how much water I'm putting into the balloon with just 10 milliliters. Okay, and then I would hang the bag lower than the bladder, okay, and not on any railing. So now I did get rid of this, because I am no longer sterile. Throw that away. You could get rid of this one too. Throw that away. Then I would put it here with either tape or a band, making sure to leave enough wiggle room there. I would put her into a comfortable position, but as I am going to get a urinary sample, she will stay in the same position. So I would clamp the tube 10 to 15 minutes before getting the sample. Okay, I would open the sterile sample, making sure not to touch the inside of it. So if 10 to 15 minutes has passed, I would get my syringe and an alcohol wipe, clean the area of the insertion, and now I'm able to get the sample. So either case, it'd be whatever the doctor has ordered, then I would put that, unclamp it, and then I would insert it here without touching the inside, okay, and then I would close it, send it to the lab, and when it gets back to me, read the findings. Now to remove the catheter, I would take the bag out, read the output, and document the output as well. So now, that's what it'd be here. I would have cleaned this already, and then I would take off my gloves, and I would have put new gloves after washing my hands before getting the specimen. And right now I would take off my gloves and put on new gloves after washing my hands as well before removing the catheter. Okay, so I would have a syringe. We're going to take, or we would get rid of that strap, put the syringe in, and the water's coming out already. There would already be a chuck underneath. I would ask Miss Minnie if it's okay for her to be exposed, if she's in any pain or anything. I would also locate and identify the urinary meatus. Okay, and I would document how much liquid I got out, which is 10. Okay, Miss Minnie, so now I'm going to pull. Is that okay? Can you bear down a bit? Bear down. Okay, perfect. So I would check for tip intactness, and then I would dispose of the urinary catheter as well. Okay, and I would take off my gloves. Take off my gloves, throw those away, wash my hands. Gonna put on new gloves. Remove the chuck. Throw that away. And then I would get her back into a comfortable position. Okay, Miss Minnie, we're all done. So let me lower the bed. Okay, Miss Minnie, is there anything else I could get you? No? Okay, put her call out here. Make sure she's comfortable. Document all my findings. And then I would provide privacy, clean the room, get rid of everything, and then take my gloves off and leave the room.